What actually happens if you are diagnosed with the coronavirus or COVID 19? Or maybe you are wondering what happens to you if you think you might have the virus. Naturally, people are anxious and fearful when something like this happens, where it's a new infection, unfamiliar condition, and uncertainties. Will you need to be hospitalized? Will you need a ventilator? Or will it feel like a typical flu? First step is try to relax and be positive. First and foremost, COVID 19 is a virus that affects our respiratory system, affects our breathing system and the lungs. Most of the people who have symptoms, approximately 80% of them, end up having mild response, and most of their illness only lasts about 2 weeks. They do not need any admission to the hospital. They usually require isolation for about 10 days at home, and it will not require any special treatment. You might feel mild symptoms, but it's super important that during this time you stay home and stay away from other people. It's also important to note that sometimes a person won't experience any symptoms but still has the virus. This is yet another reason that social distancing is necessary to slow down the spread of COVID 19. About 15% become seriously ill and require oxygen treatment, and 5% of them become critically ill and need intensive care. Older adults and those with chronic or underlying medical conditions like diabetes or lung disease or heart disease, they are more likely to have this type of severe reaction. Overall, it means majority of them have mild symptoms. By taking appropriate measures and monitoring, it helps in preventing the complications due to COVID 19.